Welcome to Flockel Show, and in today's video, we are diving into a common but potentially serious skin infection, which is known as cellulitis. Whether you are a health care student, a caregiver, or simply curious about your health, understanding cellulitis is crucial. So we are going to break it down into definition, causes, complications, and treatment, all in one easy to follow video. I have started by defining what cellulitis is, but to be clear, I've said that cellulitis is a bacterial infection of the skin and the tissues beneath it. It usually affects the dermis and subcutaneous fat layer, making the area appear red, swollen, warm, and painful to touch. It most commonly occurs in the legs, but it can appear anywhere on the other parts of the body. Cellulitis can spread quickly if not treated. In serious cases, it can lead to abscesses, blood infections like sepsis, or even permanent swelling of the legs. That's why it's important to recognize cellulitis early and start the right treatment. Now, we can talk briefly about treatment, especially the antibiotics available. Most cellulitis cases can be treated with oral antibiotics, especially if caught early, but some need injections or even hospitalization. Then when it comes to treatment, we have what we call the first-line antibiotics, that is mild to moderate infections. If you are diagnosed with cellulitis at a hospital or clinic, the most common oral antibiotics prescribed are flucloxacillin, which targets Staphylococcus and Streptococcus bacteria, or cloxacillin, often used in public facilities. You can also be treated with penicillin V, but it's good for Streptococcus-only infections. Amoxicillin, combined with clavulanic acid, which is known as augmentin, is great if mixed bacteria are suspected. These antibiotics are widely available in most pharmacies and clinics, but treatment of cellulitis requires advice from the doctor. So as Flockel Show, we are not advocating for you to go direct and start acquiring medicine over the counter. And what if you are allergic to penicillin? If you are allergic to penicillin, don't worry. You might be given clindamycin, also available in hospitals and pharmacies. Erythromycin is another alternative, but not as commonly used today. Then we have some other cases which are severe infections. In the case of severe infections or drug-resistant cases, what happens? In more severe cases, or if the bacteria are resistant, treatment may include vancomycin, given through intravenous, mostly in hospitals. And then we can also have linezolid, used for serious resistant infections like methicillin-resistant Staphylococcus aureus. Then we can also have doxycycline, or what we call trimethoprim plus sulfamethoxazole, available in also chemists or hospitals, and effective against some resistant strains. But these are usually prescribed by doctors only, especially in referral hospitals like Kenyatta Hospital or Moi Teaching and Referral Hospital. So get it clearly that these medications, you are not supposed to buy them directly from the chemist. And for those who are dispensing, they are aware that you are not supposed to dispense to patients directly without the prescription from a registered medical practitioner. Then we have supportive care and home tips. Along with antibiotics, doctors will advise you to rest the affected limb, elevate it to reduce swelling, and take painkillers like paracetamol Keep the area clean and dry. In one study from Kenyatta National Hospital, using compression bandages along with antibiotics helped patients recover faster and reduce swelling. Do not try to treat cellulitis with herbal remedies or leftover antibiotics at home. Do not stop antibiotics early just because the swelling goes down. And avoid over-the-counter creams unless prescribed. Some can make the infection worse. Then, in case things do not improve, then of course you are supposed to see the doctor once more. Go to a clinic or hospital immediately if the redness or swelling is spreading. In case you get fever or chills. In case the skin starts turning dark or forming pus, please visit the doctor as quickly as possible. If you had cellulitis before, recurrence is common, especially in people with diabetes or poor circulation. Cellulitis is a serious infection that needs prompt antibiotic treatment, and in Kenya, most cellulitis cases are treated with flucloxacillin or cloxacillin or amoxicillin clavulanate, clindamycin or doxycycline if needed. The key is to get checked early and then follow your doctor's instructions and never skip doses. Then we have a simple summary of recommended antibiotics in Kenya. For clinical scenario, recommended antibiotics include cloxacillin, if available, or flucloxacillin, oral, or intravenous. For complicated cellulitis, that is non-purulent, we might advise for penicillin V for streptococcal cases, or amoxicillin combined with clavulanate, broader coverage. And then, for penicillin allergic patients, we have clindamycin, which is given orally or intravenously, doxycycline or trimethoprim plus sulfamethoxazole, oral outpatient. Then suspected or confirmed methicillin-resistant Staphylococcus aureus, which is virulent cellulitis. This one requires drugs like clindamycin oral, linezolid, which is orally given or intravenously for resistant or severe cases. And then complicated inpatient management, we can administer intravenous flucloxacillin or cephaloxime, and we can have transition to oral once stable. Thank you for watching our YouTube channel. If you found this video helpful, please like, subscribe, and share it with your community or fellow students. Got a question about antibiotics or cellulitis? Drop it in the comments section. Stay safe, take care of your skin, and stay healthy.